polyclinic baby theft issues have come to the fore. We want to have a conversation with HEFRA, that's the Health Facilities Regulatory Authority, and then also have a conversation with an interview that we had with the Director General of the Ghana Health Service. So those are the two quick ones that we'll be doing this morning, and then to also get your input in this national conversation. What exactly should this situation change? It does appear that the focus is on the lady at the center of this conversation, and everybody seems to be forgetting about perhaps the systemic problem that we have. The systemic problem where anybody could just possibly walk into a health facility to the point of grabbing a baby to go away with. Is there a conversation about medical negligence, or is it just another talk shop by the people of the Republic of Ghana? And then we'll get into all those fine details right here on Sunrise on 3FM 92.7. So, welcome to the big conversation.
The big conversation on 3FM Sunrise. The big conversation on 3FM Sunrise.
To the Macro Hospital. It's a charge facility, and we should develop a seamless health system where charge and Ghana Health Service work together. And our patients should not even be worried whether they go to a facility, whether it's charge or it's Ghana Health Service. All they need is to get the appropriate care. But one remarkable thing about the facility has to do with the work they've done over the years to fight cancer. And that has been led by Dr. P. who has gallantly over the past 9 years worked very hard, not only to establish the center, but train many people, about 140 people within the country, in the different districts of our nation. And we think that is a remarkable thing to do. We should be visiting him, give him the best of encouragement, and able to replicate this kind of centers in our regions, take care of our women, because it's totally preventable. And if you look at the cost of preventing it, and the time you take to prevent it, as we saw today, in 15 seconds barely, you can prevent getting cervical cancer. Yes, 15 seconds. 15. Even if say 1 minute, let's even put it at 1 minute. As to paying 30,000 Ghana for a session of radiotherapy, as to traveling across the country from one end to the other, such a hospital that takes care of that, as to be in a long queue, that is worried for us to have this kind of operation, and look forward to make sure that our health system moves, and ladies are in good shape to take care of kids, to take care of their husbands, take care of our elderly, and to be part of this crusade that we want to launch on free primary health care, the Mahama cares, and for our economy, to our nurses, to enable them to have help to attend to the rest of the population that might come in search for support. But let me also take this opportunity to say that some few days ago, early 24 hours ago, we had a situation in where a lady's baby was stolen from her. A very regrettable situation. Fortunately, the security services have been able to recover the baby in good health, and the Minister of Health has given strict has given us marching orders as to the way forward in this case, where all our facilities, you might have seen the press release, should have the CCTV cameras display. Our security should be up to pin. And I have reiterated that all health facilities, non-negotiable. All doctors and nurses should use their uniform with name tags, as we see in well-established health facilities. so that if this lady, if all the nurses were in their uniform and with their name tags, the lady would have been easily identified, and this wouldn't have happened. The mother wouldn't have been confused to agree that she is the nurse, as she claimed. If we have all our doctors in their uniform with their name tags, it's very easy to identify and say it was Dr. So and so, or it was nurse so and so. So this is non-negotiable that all health facilities is just a reminder. We are reiterating it. Should always all health workers should be in their uniform and name tags for easy identification. This is just to add up to complement what the health minister, mine, was has instructed. On a visit to the Bator Hospital, it's a child facility, and we think we should develop a seamless health system where CHAG and Ghana Health Service will work together. And our patients should not even be worried whether when they go to a facility, whether it's CHAG or it's Ghana Health Service, all they need is to get the appropriate care. But one remarkable thing about the facility has to do with the work they've done over the years on cervical cancer. And that has been led by Dr. Kofi Epa, who has gallantly over the past 9 years worked very hard, not only to establish the center, but to train many people, about 140 people within the country, in the different districts of our nation. And we think that that is a remarkable thing to do. We should be visiting him to give him the best of encouragement and be able to replicate this kind of centers in our region.
And that was Dr. Samuel Kaba Akoria, Director General of the Ghana Health Service, there, sharing his own perspective and also giving a directive to all health facility workers. Now, Dr. Wilfred Ban is the CEO of HEFRA, the Health Regulatory Authority, Facilities Regulatory Authority, and he joins us on the phone line now. Doc, thank you very much for your time. Good morning.
Good morning, sir.
Yes, sir.
My regards to our listeners.
Absolutely. Now, Doc, this whole conversation about Mamprobi Polyclinic baby theft, where did we drop the ball?
Well, thank you very much. It's quite unfortunate. Safety at the health facilities is very important to us. And every year when we go around monitoring the facilities, we always tell them that security is important. In fact, some time ago, the minister has given a directive that all health facilities must have CCTV cameras for security.
Right.
And these are things that are part of our checklist when we go around. And we try to enforce them. I must say that we haven't been very strict on it. But from now, we are going to be very strict. And I think the minister brought out another circular saying that all health facilities must have CCTV. So going forward, as an agency, we are going to enforce it. Apart from that, we also said that they must have security guards at the entry and exit points to make sure that the security of patients and even staff is guaranteed. And that we are also going to enforce that. Going forward, we also sent a circular some time ago that everybody who is on duty in the hospital must have a name tag properly written, their cadre, their name, and what they do. So the person who went in and impersonated, if they were enforcing the wearing of the name tag, they would probably have seen that this person is not a staff of the hospital. Like I said, all these things gives us an opportunity to improve the system. And so we are going to visit the hospital today, and then afterwards we will bring out some general guidelines to guide the other facilities in the country in that regard.
Does the Mamprobi Polyclinic have HEFRA certification?
Yes, they are registered. Their license will expire in November 2026.
I see. Now, for the uninitiated, what boxes do you tick for a facility like the Mamprobi Polyclinic before you give them certification?
So before we give any facility a certificate, number one, you will have to make sure that you have the necessary documents, being one, fire safety. So we look at safety in the first place. So the facility must have a fire safety protocol. So before we come, the fire service must certify you that you are safe when it comes to fire, and that in the case where there's a fire outbreak, we will have means of mitigating. Then we also need a EPA certificate to show that your waste disposal and everything is clear. Apart from that, we look at the human resource.
Right.
And that depends on the level. So for Mamprobi, the polyclinic, not say hospital, but it's licensed as a polyclinic.
Right.
So we need a certain number of doctors, nurses, lab pharmacists, and then the other staff, including security and orderlies. So we check all of that. And then there are professional registrations to make sure they are in good standing with their professional regulators. Apart from that, you also look at the infrastructure. Is it safe for patients to sit in? We want to make sure there are no live wires that will cause fires and then electrical shocks, no cracks, and all of that. Then after that, we also look at equipment. Do you have the necessary equipment that will provide the level of care you are licensed to do that? We look at it. Then you now look at the processes. So, for example, if we had gone to Mamprobi today, we'll be looking at, okay, so which people were on duty? You knew there were 3 midwives on duty. So if you've seen the 4th person, who is in charge? Have you questioned the person? What was the time of the patient arrived, delivery, who took care of the baby, and all of that? So we will have to go through all the processes that go on in terms of taking care of the patient. And those are some of the things we look out for.
You are a very experienced medical doctor, consultant, if you will. Now, not so long ago, we had a situation at a Ridge Hospital where a rotational nurse was said to have, had her shoulder dislocated and hand fractured. The health minister set up a committee, went into it, found out that that was not the case. And then now we have this situation at the Mamprobi Polyclinic where somebody is supposed to be in charge and available to ensure that what happened does not happen. There could be many other examples that people can make reference to. In your opinion, should such people still be practicing? Shouldn't their licenses be revoked?
Yes, so that's why we are going into it. Like I tell you, for everything that happens, we investigate. And then for when people have to be penalized, we will do that. And we'll make that open to you. So give us some time. We have started our investigations. We'll look at where the lapses are. And for me, the most important thing is to put in remedial measures to forestall these occurrences. And not just for Mamprobi, but for all health facilities in Ghana.
So if I hear you right, you're going to investigate this and then apply sanctions if it is found out that somebody was culpable. But
exactly.
I'm insisting that we had the situation at Ridge Hospital. What sanctions were applied on the individuals, the medical officer who signed off to suggest that a hand was fractured, shoulder was dislocated, the other people who were working there? Some doctors went around media houses telling people and corroborating the story, which the health ministers committee found to be untrue. What sanctions have been applied to those people?
So the minister set up that committee and made recommendations. Those recommendations went to their professional councils. So the nurses were sent to their Nursing and Midwifery Council. The doctors were sent to the Medical and Dental Council. So they will be able to tell exactly what happened to them.
So from a HEFRA point of view, you cannot say what punitive actions were applied in this case?
No, in that case, we will not be able to say.
Does
So
that
usually, when there are
right.
the individuals involved, you refer them to their professional counsels, and they deal with them. We deal with the facility.
Yes, I get your point, but then I'm asking this question in relation to the boxes that you told us a while ago that you tick, that
Yes.
they are supposed to be in good standing with their professional organizations or associations or groupings.
Yes.
Now, in terms of professionalism, patient rights and all of that, someone can say that the patient's rights have been breached, and so somebody must be punished for it. So, for example, if this that happened at Ridge or what had happened at Mamprobi Polyclinic had happened in the UK, people's licenses would have been revoked to serve as a deterrent. Why are we not doing that?
Oh, we do that all the time. We do that all the time. If you talk to medical and dental council, they've revoked a number of licenses due to some of these things. If you talk to nursing and midwifery council, they've done that. So it happens. Maybe they just don't bring them out, but it happens. And I can tell you that when we go into it, those who are culpable, they will have the appropriate sanctions.
Would you consider what happened at Mamprobi to be within the domain of medical negligence?
Well, negligence, I am not sure, but yes, there is some breach of duty, because when somebody comes to your hospital, delivers, the safety of the baby is in the remit of the hospital to make sure that. So yes, I think that there is some breach of duty.
Now, let's look at the remedial things that we can put in place. Immediately, what can we do? Or what do you recommend that we do?
Sure. So, for others to be safe, I think yesterday my minister released a statement and reinforced the fact that all health facilities must install CCTVs. And very soon we will bring in guidelines giving them deadlines to install the CCTVs. Of course, and then the guidelines, because you also don't want to also breach privacy. So it's not everywhere they can be. Then also enforce the security and at the place, at the hospitals, and also the compulsory wearing of name tags and the and then the appropriate apparels for every like for nurses, doctors, and you need to wear the appropriate apparels. So those ones too, we are going to enforce them. We think that these are a few of the things we can do to forestall some of this. So nobody can come in and impersonate, and then nobody can come and pick somebody's baby without anybody recognizing it. It's not right, and it must not happen again.
Doc, you will remember not so long ago, we had this conversation about CCTV installations in all police stations in this country. I can tell you a good authority that it has not happened in most of the instances and most of the stations. So how do we then come back with another CCTV conversation because an issue happened? Somebody died, Chief Inspector Ashilevi died, and then we said we're going to install CCTV cameras in all police stations. Up until today, that has not happened. So are we getting another promise that would not be delivered?
Thank you. I can assure you that we are going to enforce. Once my minister has given the directive, I will make sure that it is enforced. So we will come out very soon and give the hospitals deadlines to fit CCTVs. And I will update you, Joy FM.
This is actually 3FM.
Oh, sorry, this is 3FM.
Yes,
sorry.
it is 3FM. Now, the other question is about those facilities that are working without the proper authorization, for example, from your office. Recently, the Akawe clinic came into a conversation. People were being treated there, but they did not have the requisite certification, how do I know that a facility is properly certified for me to go and receive service there and put my life in the hands of those who work there in those facilities that are not certified?
Sure. Yes. So you remember last year we embarked on an exercise
Right.
to close down unsafe facilities that are operating without a license. And this exercise we are continuing. But it is mandatory for every health facility to display their HEFRA license. And so every patient who walks into any hospital, you have the right to ask them that I want to see your HEFRA license. If they refuse, just kindly send us a message. Or go to our website, just send us a message. And then we will take it up. Because that alone is a breach of the law. Also, you can also go to our website.
Right.
And then you'll be able to find if they are licensed or not. Our licenses now have some security features, including a QR code. So when you go, you can just scan it, and if it's authentic, you will see it.
I see. Now, there's also the growing conversation about, for example, pharmacists, some clinics, people who work there who may not be thoroughly qualified. And again, I'll make reference to the Akawe situation. In that instance, do I go asking the individual providing the service if they are qualified? Because obviously they will not be walking around with their certificates.
Exactly. So if you have any questions, usually they have a hospital administrator. If you are not sure of somebody, you can approach them and say, I want to know if this person is licensed. You can ask the individual, but you can also ask for the hospital administrator or the doctor in charge and said, I think that I am not sure about this person and I want to know. It is your right, and they should be able to give you that information. And anytime you look for information you don't get, just contact HEFRA. We have regional offices. They will get in for you.
Dr. Winfred Ban, I thank you very much indeed for your time this morning.
Thank you, sir.
Great.
Thank you.
That's Dr. Winfred Ban. He is the CEO of HEFRA, and he joined us here with some knowledge that we all should know. So now you know it's your right to enter a facility and actually demand to be shown the HEFRA certification so that you know that you are receiving care from a facility that is authorized to provide the facility, the services that you are actually going to seek. very much indeed for your time.
Good morning, sir.
Sir.
How's life?
I'm alive. It's my good
We
friend.
thank God for some time now.
Yes.
Yeah.
How are you doing this morning, sir?
Oh, I'm good. And greetings to your listeners and greetings from Kumasi, Ashanti region.
That's right. Now,
Yeah.
you are National Vice Chairman of the Ghana Coalition of NGOs in Health.
Yes,
What do you think of what has happened at Mamprobi Polyclinic?
Yeah, thank you very much. This is a worrying trend. It has been surfacing once in a while, and it's one too many. And we think that we have to, as Ghana Coalition of NGOs in Health, we have to take it as a very serious matter.
Mm.
And if you look at the trend for the past years, it normally happened to vulnerable women. Vulnerable women in the sense that though they call middle class or low class women
Right.
who go to deliver. And it's very disturbing and worrying in the sense that I don't believe those who are engaged in those things are doing it as individuals. It should be like a cartel or a group of people who exploit and take advantage of maternity homes or where they look at the environment, study critically, get an insider, and then operate.
So you think
it's a
this is
very
an
serious
inside job?
matter.
You think this is an inside job?
Oh, with all indication, because when you look at it, it's an inside. There's an inside that someone is cooperating with them from inside within, and because it's always happening in public hospitals, the idea is that the security situation is low,
Right.
and then maybe the policy gap, which we have to actually coalition of NGOs have to look at it again and see if there's a policy gap as to what are the requirements for a woman who goes in labor
Okay.
should do. I think it's high time we look at policy and make sure that either the husband or the husband representative should go along with the woman and put her eye, because someone can give birth and collapse. You understand? Before she wake up, they say your child is dead or your child cannot be found. So look at the policy particular about this incident and then see if there's a gap. There should be a second person to watch over the baby. The woman may give birth, finish, she say, I'm going to bath. Then you leave the place and to go and take a shower. You can't find the child. So there's a lot of things we have to look at it and also improve the security. As for name tags, anybody can write a name tag and go, that's a mess. So the solution to this problem, and they're happening in all the government public facilities. Have you heard any child being stolen in any public facility? Currently, we have an isolated ward where they can afford to pay. But this one, where they are all in the same room, they are all dumped there. They dump the babies there, and anything can happen. So you call for thorough investigation. They shouldn't just hold the person responsible. The security agency should go a further step to try to unlock those who are accomplices. And that way, and if they are caught, they should severely punish to serve as a deterrent. But apart from being served as a deterrent, it is high time for Ghana Health Service, Ministry of Health and Ghana Health Service, to look at the policy guiding a woman going into labor.
I see. What could really be the motivation for another woman or man to steal a baby who has just been born? What have you been finding out?
Yes. So there are so many factors that encouraging that. One is a sociocultural factors. Like you go, sometimes I just take a walk to private facility.
Right.
And you can see the number of women who are lined up to do IVF or to do whatever they can. They don't even succeed. And then the marriage is breaking because of that. Ghanaian and African culture, married without the fruit of a child is like there's no marriage.
Right.
So the couple will go all length to go and get a child. And they don't want to go in to adopt a child because they ever know they can't bring a grown up to the child. So the woman will just pretend, put some rags in the stomach, say she's pregnant, and they steal a baby for the person, and the person is then nurse it and have it as a child. That's one of the factors. Apart from that, too, the people are making it as a commercial venture. They go to make money. Oh, I promise I can get you a newly born baby for this amount of money. So the money will be distributed along the value chain to ensure that they actually pick the child from somebody who has given birth, vulnerable who has given birth, and go and sell it out, and they will share. So both economic and social contract factors are the main cause of this attitude.
Selling the child for what, rituals, or selling the child to keep the child and raise the child, knowing that it is not yours?
Yeah, but for selling a child both for rituals, and the rituals are possible, but the rituals are to a greater extent are getting less than those who desperately need children as a family. And they are not prepared because of the social stigma. They are not prepared to go and adopt a already grown up child.
What do you say to the suggestion that the lady in question could be having a mental issue, and so psychiatrists should be brought in rather than trying to punish her through the law? What do you say to that?
Yeah, that's why I'm saying that this call for a thorough investigation. And what we mean by thorough, I'm looking at it from all angles. From the psychological point of view,
right,
to the social, economic, and cultural point of view,
right.
Because somebody looking at what I saw on the social media, if that how she dressed, I don't think this person have a psychological problem. Because the way I saw, maybe the clips I saw might be wrong, but here's exactly what I saw. This is a person who has actually planned and executed something she planned. But we cannot rule out the psychological part. They should investigate all the aspects of life and investigate and see whether she did it solely or it's a cartel. Because I know in Accra, it used to happen at this the other place, the popular place there. And now it's at Tema General Hospital.
Right.
We used to hear a lot from that place. Now it is moved to Mamprobi Hospital. Who know the next facility to go to?
You mean these facilities have recorded children getting missing after they have been born?
Yes. So it's a very disturbing news. And then it comes, we talk and then relax. And then with time, they will study the environment, then they will strike again. They will talk and relax. The other one said that it is high time coalition NGOs. I'm calling for it to review the policy that guide child delivery. Because of congestion, they will allow the woman to be there. You understand? And that one, the person may give birth, after giving birth, so many things can happen. He can have so many conditions. And take the eye off the baby. So there should be a second eye temporarily, because the cameras are there, they are blurred, you can't see it, they can't play them back. There's no security in the facility, and the nurses themselves don't know themselves, because there are so many people click out, those who are doing rotation, those who are permanent, those who are so many. So you cannot actually begot the HR division of the unit.
Let's take a look at the Ridge Hospital situation, and I'm sure you remember that. That's in recent time. Where a medical officer, knowing full well that the information he has put or she has put on the report or captured in the report, suggesting that somebody's arm has been dislocated and the hand has been broken or fractured, and still signed it off. But that individual, well, I don't know, but could still be working within the health sector. How does your association receive that news?
You know, our association is just set up to ensure that we have better quality health services.
Right.
So anything that negates, that try to, and then not only better, give equality, that is equity. Anything that go against even patient charter is a matter of concern to us. And we are doing advocacy, engaging at high level meetings. And fortunately, we attend most of the high level meetings where we raise some of the issues at the table. Then we try to see how best we can also play a role to solve it. We don't only criticize, we don't only talk, but also try to put suggestions on the table so that we'll see how, if it's implemented, so what we can able to eliminate or limit the problem so that healthcare can be a place where you can get what you desire, not to go to a health center and leave the place miserable.
Do we take medical negligence serious in this country?
Well, the level of technology is affecting medical negligence because there are so many things. But if we raise that issue and go to court, and we don't have so many lawyers who are medically inclined to justify and prove your case for you. So anybody who takes the case against medical negligence finally ends up by losing the case. But gradually, Ghana is changing. There are so many things come on board. And I know within the next possible years, medical negligence will be something when somebody is involved will actually be put to tax to respond and answer for the negligence. It's happening. People are dying. And even I myself, my son, nearly died out of overdose from a medical doctor. He prescribed that my child was just quite young, fell sick. I was there in Accra, and they took her to the nearest hospital. And the doctor prescribed overdose medicine for the child. Fortunately, I arrived, I look at the history, I said, no. If he has taken this injection, why is he taking this drugs again? So I told my wife to went there. The doctor apologized to us and withdrew the drugs.
And
so assuming that the person,
you didn't
the
take
person
action?
ignorant. I didn't take action because I went, because it was a private facility. I went and met the management, spoke with them, and then we discussed at length. And they promised me so many things to do. But later when I went there, that particular person was no longer coming to do locum there. I tried tracing. But when the person finished, I don't know where the person was posted to or where the person was again. So I left the issue to them. But at least the effort, he will now be careful as to what he writes. Because I was privileged to read. I was privileged because I could read and write, and I know a little bit of medicine. So I looked at it and I saw that no, you are giving the child this injection, and you say in truth they should give her these drugs. And I went. So that was so. There are so many things happening in the health sector, and sometimes the negligence too is sometimes caused by pressure. So they cannot withstand pressure. They are doctors, all right, but they are not trained to be emotionally stable. You understand? They don't have that personal...
Under pressure.
Yeah, they're under pressure. So sometimes, I know a case around 1997 or so, Mensha Government Hospital in Kumasi here. An adult went and the doctor wrote a syrup for the adult. So later, when I went to the pharmacy shop to buy, then they asked why, then because they saw the age was 45. And they saw that. Then they went back to the doctor. Oh, I'm sorry. I'm so tired, exhausted. I've been here since the morning. And then he then collected and rewrote a new prescription for the person. So the pressure on them to sometimes affect for those who are not emotionally stable to make a serious mistake. They are not little mistake. If you make a mistake, it's a very grievous one. So there are so many there are so many things we have to come together. Now we are now forging for One Health, where different aspects of how does the road accident affect health delivery? How does Ministry of MOFA affect health delivery? How does veterinary affect health delivery? This is the area we are now going towards. And when we have to form these synergies, we think that we will make advances towards health delivery in the country.
How does your organization support people who may have experienced medical negligence but are vulnerable, may not have the wherewithal or the financial muscle to go to court to get justice for themselves? How do you support them?
Yeah, so in terms of support, one like let me go with the negligence aspect. We are not also financially sound to engage a pro bono lawyer for the person. But what we normally do is that what we have done very well and successfully are those who are not able to pay for the health service. That will go and negotiate with the social welfare and they trigger that policy who says that if a patient go to seek a health care and is not able to pay, the doctor and the social psychology department must go and assess the family background and see if it is true they have a challenge, then they write off the debt. We have that one coalition. We've done more than I can't count number of people assisted in that way. But with the lawyer engagement of a lawyer for litigation against this, we haven't made serious strides in that, and we are considering it in our programs. So we are now trying. We have as of now we have one medical doctor lawyer who have been roped into our board. So we are now discussing with him to see how best we can become a policy. Because merely become our policy, we can then we are mandated to do that, so that anybody who is responsible, you have a document that supports your action, so that it doesn't look as if you are doing something. So currently, he's drafting the policy for us to have it as a document, as a working document for the coalition.
My closing question to you is that the health minister has given certain directives. The Ghana Health Service boss has also given certain directives. HEFRA boss says that, well, thorough investigations will happen. But what do you see? Do you see anything coming out of this, or is it just going to be another talk shop?
Yes, I think to a greater extent, we are supposed to be the voice of the voiceless. So we have assigned one of our members who works at Mamprobi to follow up on the issue, and we shall follow it to the end. And if we are not satisfied, we'll organize a press conference to that effect. So these are things we put in place. So if I find a member, he works in Mamprobi, Enclave. So he's going to follow with the eagle eye. And then definitely we'll have a meeting with the Minister of Health and then their distance. We shall be raising it at our meetings, technical working group meetings, to ensure that we will see the final report. And we appeal to the journalists to make a follow-up. We shouldn't just talk after 1 or 2 weeks. Let's go after journalists after 2-3 weeks, 1 month. We'll go and find out what the state, which state have they reached, and that one to put them on tools. Because you will have the voice. Your voice go far and wide. So definitely, we are not going to leave the case to rest. We are going to do our best to ensure that we will unravel the mystery behind these issues and to serve as a benchmark to forestall such occurrences in other health facilities throughout the country.
I thank you very much indeed for your time this morning. But a message just came in that, well, in the UK, the responsible pharmacist for the day is required by law to display their license in a visible location in the facility for all to see. Without it, no dispensing or sale of medication can take place. Can Ghana do that?
We can do it. We can do it. As I said, it is a policy issue. That's why I said we are looking at as I said, currently we've called for their policy on maternity policy. How a patient should be treated. They want to analyze it critically. They still can extend to all facilities. You see, we need to look at. We have a lot of policies, but are they really implemented? and which are the gaps that are identified. So we are going to go through some of these things, and from time to time we'll have what we call a policy brief. So we engage the stakeholders, and then we'll see how far Ghana can go. Because now we are talking about it is high time we maximize our potentials, because within the next 3 or 4 years, donor partners will move out of Ghana, and health delivery will solely be the responsibility of the government. And we cannot waste our country resources on matters like this. So it calls for us to revisit all health policies, patient charter, to see if there's a need for it to fill some gaps or identify some gaps and fill it. So we are on process. It's a long process. It's a process, but it takes some time. But definitely we are bent on it, because we are part of the roadmap for existing Ghana from the Global Fund by 2030. We are among the technical working group, and we're looking at all these options.
Okay. I thank you very much for your time. Nisao Dako Alaza is the National Vice Chairman of the Ghana Coalition of NGOs in Health. We're grateful for your time this morning.
You're welcome, sir. You're welcome, sir.
Okay.
The big conversation on 3FM Sunrise.
Joseph Gold Armstrong Alogbe is a reporter here at Media General, and yesterday he went to the Mamprobi enclave where this unfortunate incident happened. Joseph, good morning, and thank you for your time.
Good morning, Johnny.
What did you find yesterday when you went to Mamprobi?
Johnny, so yesterday I got to Sukura, to be precise. Mamprobi was where the incident took place,
right,
but where the lady involved lives is at Sukura. That is where she lives with the husband.
Right.
I'm told she's married to one man, and she happens to be the second wife to that man. Yesterday, I have to go through a lot of this to just locate to where she was staying, because everybody was just scared to open up. They first directed me to Dansuman, that's where she lives. I went there, it was a lie. I came back, Mamprobi is a lie. Then finally, one person said, okay, you go to Sukura. Even that Sukura, it took me more than 3 hours before I finally got to the exact location where she was. Meanwhile, where I was standing was right where she lives, but nobody was opening up to speak. Finally, but there's one thing that caught my attention. Almost everybody, even though they claim they don't know where she stays, they all have something good to say about this lady, that she's a very good woman. She's humble. Her human relation in the area is superb, and they are really surprised this has happened to her. Just that they cannot show me where she stays. You know, and I'm sure if she was a bad person, everybody would have been in haste to direct us to where she lives. But you could see, because they thought they felt she's a good person, they were not willing to open up to tell me where she was. But yesterday, finally, when I got to the house, I realized that the husband was not home. I'm told he's also going through a lot. I mean, he's traumatized with all the incidents, because when the wife brought the baby to the house, he was surprised himself, because when did you give birth? You never told me you were going to the hospital to deliver. When did this happen? And it took the alleged woman's sister to open up that, look, my sister is lying. This baby doesn't belong to her, and that is somebody's baby. Then immediately they have to call the Dansman police to come in for the baby, which led to the woman's arrest subsequently. So exactly that's what happened yesterday when I got to the residence.
What was the woman's demeanor yesterday when you met the lady in question?
Yesterday, we met her at the Dansman police station. Her demeanor clearly shows that maybe they would have to examine her. I don't know, but she didn't look like somebody who really has any regrets or do anything. She was okay. She wasn't perturbed. She was just normal, and she kept her fingers in her mouth. She wasn't saying anything. She wasn't sad. She wasn't happy. She was just normal, just like that, you know. So maybe beyond what people are saying and what she has done, maybe some medical officers can also be deployed to maybe take her through some tests and see what really might have gone wrong or happened and why she wants to do that. Because I'm told that she just married barely a year, and the husband is not really putting any pressure on her to give her a child because the woman herself has 2 children already. I'm told she has 2 boys already. The man she's married to also has children already. So they are surprised that she has to go to a hospital to kidnap somebody's baby. It's quite strange. So exactly, seeing her yesterday, she didn't look like somebody who had any regret or even knows what she has done. Johnny.
Now, is she in the custody of the police?
Yeah, she's still in the custody of the Dansman police. You are told that she'll be sent to the court later today.
I see. Armstrong, we thank you very much indeed for your time. But before you go, we earlier saw some relatives and friends who had gone to the Mamprobi clinic to, as it were, show solidarity for the victim and also to help. Did you meet any of them there in that area? Ashukura?
No, I didn't go to the hospital. I didn't go to the polyclinic. I went straight to the police station and also the residence of the alleged baby kidnapper. Johnny.
Joseph Armstrong, you also spoke with what? The traders in the Burkina conversation?
We are currently here at the 37 Military Hospital,
Right.
as I speak to you now, with the
Right.
CDS and then that of the service chiefs. They are here to pay visits to the women that were caught in the Burkina Faso attack
Right.
sometime this week. So we are yet to hear from the CDS and then also that of the service chiefs that are all gathered here.
Thank you very much, Armstrong. We're grateful.
The big conversation on